So let's talk about the very, very pressing issue that has affected most health institutions in Africa over the years. And I'm forced to even doubt if the African nations are intentionally doing their bit with respect to sorting out this particular challenge. You know, in Africa, we have a very big challenge when it comes to accessing healthcare. And some of it are bordered around infrastructure provision, while some are bordered around the poverty rate of most African nations. And then some of them also bordered around the inability of having appropriately skilled professionals to carry out these medical functions. So to make up for this, in advanced nations, this gap is always provided for by health care insurance. So in Nigeria, sometime in 2002 or 2004, thereabout, the National Health Care Insurance Agency was passed into authority. So this is the federal body that is responsible for handling everything that pertains to insurance in the Nigerian state. Now, you may be forced to think that between 2004 till now, which is almost, let's say, 2004 to 2014 is 10 years, 2014 to now is another 10 years, so which is around 20 years. So you would be forced to think that a country like Nigeria with a population of over 250 or 300 million people, that at least we should have, let's say, 50% of that population covered in the health insurance, with the health insurance scheme. But the reality that dawns on us is terrible and is unfortunate. So what is it about health insurance? How does it work? Health insurance, let me explain it in a lay term, is just more like, let's just say those of you that play sporty bets, those of you that play betting, football betting and the rest of them. Every weekend you are contributing something to the scheme. For the guys who use the National Healthcare Insurance System or the Healthcare Insurance System, so it's all about gradually putting funds into your healthcare scheme. So the aim of putting these funds, which are called premium, is so that the day that you fall sick, these healthcare insurance bodies would pull from that resource you've been contributing over the years gradually to offset your medical bills. So now when you put this money into these healthcare insurance programs, they don't just keep the money. The guys in the finance sector use this money and do some investments which is supposed to give them yield profit for them, which at the end of the day, they use a fraction of that to pay for your healthcare insurance of their clients. Now, why I likened healthcare insurance to sporting betting is this. For some reasons, you may do your healthcare insurance for a year, and if you are someone who is so health conscious, you may end up not using that healthcare insurance because you may end up not falling sick, or you may end up being so health conscious that you may never get to use that. So the beauty of it is this: in that situation, the healthcare insurance smiles to the bank, which is what is supposed to be their business. But if the reverse happens and you fall sick, they are going to pull money out of there to pay for your health care. Now, I am really amazed, you know, when I was listening to Professor Ali Muhammad Pate, you know, give his reports on what they've been doing so far in the Ministry of Health and Social Welfare. He talked about moving up the population of people who are covered by the National Health Insurance Scheme from 17 million to 50 million. So you can still now do the maths, compare this to a Nigerian population of over 200 million. Then you can check the fraction of the people that we are still hoping to get into the insurance scheme.